beautifully. Welcome to my YouTube channel. I'm going to talk about reasons to become an LPN, okay? So, or advantages of becoming an LPN, or like the reasons why you should be an LPN. I have my list here. So, one is a short time schooling. So, the school system has made it that, to become an LPN, you just only need 1 year of schooling, excluding your prerequisites, okay? I'm not adding any prerequisites here unless you go to some certain schools. But for a standard schools, community college, LPN is 1 year, then your prerequisites is excluded, okay? We're getting that kind of a diploma and you can work and make more money as an LPN. It's just 1 year. You know what I mean? Like, it's a big advantage. And this is one of the most reasons you should do LPN, all right? Two, it's a program to choose, especially if you're already a bachelor's degree holder or a degree holder. You know what I mean? Like, let me say, I did a degree before, then now I consider being a nurse, and I don't want to go back to school to start all over again. I can do LPN and also be a nurse, because I've already have a degree. What am I going further to do? I'm already a degree holder, so I can just go and do 1 year. And some schools, they won't give you scholarship if you're a degree holder. So LPN is the easiest way and the shorter thing to do if you're a degree holder. Like, the advantage is much and huge, all right? You can work as a primary nurse. Like, you can be LPN job. Like, you can get a job of one-on-one, taking care of one patient while you go to school, because you know that so many nursing school is so stressful, like you can't even work. So, but if you're an LPN, you can still get money as a nurse and still work one-on-one. So within that one-on-one, you read your book, you do your assignments, you pay for your school fees, and still read and pass. It's not like, there's a lot of opportunity in nursing. So that's why you have a big advantage of becoming a LPN before going back to school, so that you can pay for your school fees, all right? Another reason to become an LPN, okay, or the advantages of becoming an LPN is this: you can work anywhere. When I mean anywhere, you can work in rehab center, you can work in a hospital, you can work in hospital, different unit too. Emergency unit, ER unit, med-surg unit, cemetery unit. You can work in a different unit. You can work in outpatient hospital, okay? You can work in doctor's office. You can work in mental health facility. Like, so many jobs opportunity are waiting for you out there. Like, are waiting for you out there. So when I hear some people saying LPN is not a nurse, I look at them somehow and I laugh. Why would you say that? Okay, it's more like a bachelor's degree, master's degree holder in nursing comes now and tell me that RN is not a nurse, that is BSN is a nurse. No, they have their hierarchy, they have their hierarchy. Like, they have the steps. They have, LPN is under RN. They are nurses. They have a license. Do you know how it takes to get a license? A license, I'm not talking about certificate though. I'm saying license. License is very, very Good. Do you know how much people suffer to get license? So when I hear some people saying, I want to become a nurse, and when you ask them which type of nurse, they say, RN, of course. LPN is not nurses. I was like, I wish you can come to hospital one day. You will see where you'll be answering LPN. Hi, nurse. Nurse, please, oh, how do I pay? Nurse, please, oh, how do I do this? LPN is a nurse, okay? If you want to Google, what is their name? Licensed practical nursing. So, what are you talking about? They are nurses. They are licensed to be that nurse, okay? The other one is LVN, the same thing as LPN, depends on the states. Licensed vocational nursing. Okay? So, what are you talking about? They are all nurses. LPN is a nurse. Alright? So, when I hear people say that, I look at them like they are ignorant. How can you say you are not a nurse? You are a nurse, alright? So, you will tell me that, the only thing you will tell me that there is some things that LPN can do and RN, like there's some, like the job are similar but a little bit different, okay? An LPN cannot just go and start a blood infusion when the doctor prescribes it. The work is the work of RN. RN can go and start it and take it for maybe 30 minutes, then hand it over to the LPN, and that LPN, it becomes your burden. All right, so there's so many things, like in the hospital aspect. The first assessment when you admitted a patient is assessed by RN, but in long-time care or rehab care units, the assessment, the first assessment can be done by LPN. Why? Because for a patient to go to a rehab center or long-time care, the patient is a little bit stable. So LPN can treat a stable patient. Why? In the hospital, the first admission is for RN. You see the different, like minor thing are the different. And you see that our LPN has already know how to do head to toe assessment, the same thing you are doing. She already know it, but it's just that the license, you have to follow the rules. All right, so that's the some small different. The IV starts, like, to put an IV. I heard some people in the hospital, some hospital do teach LPN for that. Did you see that? They have a training for that, for them to start putting an IV. But it's not a just scope of LPN to put an IV. It's an just scope of RN. But in terms of administering the antibiotic, LPN can administer antibiotic too. Like, so when I hear some people saying LPN is not a nurse, LPN is not a nurse, I laugh, and I don't like to argue people. That's one thing about me. if if you are my good friend, you know that if you tell me 1 + 1 is 1, I believe you with all pressure. If I'm arguing with you, you know that the love is too much, or I just have time. I don't normally have time for myself. Talk more of arguing with people. So if you tell me 1 + 1 is 1, I believe you. And some people might even say, how do you believe everybody, whatever they tell you or whatever they told you? I don't really cares. It's what you cares that you argue. I don't cares. Okay. So if you tell me 1 + 1 is 3, and that's your business, that's okay. If you say it's 3, it's 3. I mean, why should I argue with you? So if I hear some people telling me LPN are not nurses, I just look at them like this. What are you saying, girl boy? So back to my my topic. Anyways, I don't want to go off my topic. The LPNs can work anywhere, like I said previously. They can work anywhere. They are licensed practical nurse. They can, like, doctor prescribe patient. They can put in they can put in orders. They can work in the hospital. I don't know where people do hear all those things. They will tell you LPN doesn't work in the hospital. No, madam, no, boy, no, madam, no, oga. They work in the hospital. They work anywhere they want to work. All right, as a licensed person. All right, it's just that they already know the scope of what they should do and what they should not do. That's it. All right. So So the another advantage is it's easy to bridge into RN because you're already an LPN. So your RN is easy to bridge in, like it's 1 year again. And when you bridge into your RN, it's not gonna be as much hard as it was when you do your LPN. Because when you did your LPN, you don't know most of the things. Most of the things you see them you as an aide, if you're an aide, or if you see them like you don't know any of those things. But now you know something about it, and not only you know something about it, you are working. You know, you have experience, you gather experience, so you are working already. So when you are working already, so the bridge program will not be as difficult as it was when you were an LPN. So this is the major 5 reasons to become an LPN, and also the advantages of becoming an LPN. And the last but not the least, if you have children, this is the most easiest way to become a nurse. Okay, so if you have a little children, you don't know where to keep them. This is just 1 year. Pam 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 pam. 1 year is gone. You know you become a nurse. You see why I say is this very very good. I also already made a video of disadvantage. Look at my channel, my second channel. You will see it there. Okay, so I'm gonna post this one on that channel. So this is the main reason, the 5 advantages of becoming an LPN before RN, or the main reason to become an LPN before RN. Okay, thank you guys. I love you guys so much. Please make sure you subscribe and share my video. Thanks.